Hello everyone, my name is Dr. Balraj Shukla. I am currently associated with the College of Dental Sciences and Research Center in Ahmedabad, India. I am a periodontist by profession and I am very glad to present my research at the 32nd World Seminar on Neurology and Spine Disorders. So I'll be speaking on the effect of Indian percussion music instrument on the oral health, motor skills and social skills of children with autism. Now, as you can see, autism would be the basis of my study. And if we consider a very brief history of autism, then we come to understand that Leo Kanner was the first person who actually published in the literature about his observations on what could be autism back then, because initially it was very difficult to distinguish between autism, Asperger's, ADHD and schizophrenia. It was only with the advancement in medical science that we came to a neurological perspective and we understood that autism is not simply a disorder, it is a spectral disorder. And we were very smart in getting vaguer and vaguer about its definition over the period of time. And currently what we know it is as an pervasive neurodevelopmental disorder. Now when we use the word pervasive, it means that it is not fixed to one particular thing. I mean, the effects of this particular disorder are vast. They are not something you can particularly handpick and say, okay, this is autism. It is not as easy to distinguish. In fact, one of the books that I was reading on autism, it was titled The Autistic Brain, and it was written by someone uh, who herself suffers from autism, and she researches on autism. And according to her, at a neurological level, it is still very difficult to properly define autism. So mainly, it is characterized by impairments in social communication and restricted repetitive patterns of behavior, interest, or activities. And something that is not associated with its diagnostic criteria are the motor skill deficits that we actually see very often in subjects of autism. And these motor skill impairment involve stereotype behaviors linked with upper limbs and body balance. So that is exactly what we saw in the definition by the DSM-5, that is restricted repetitive behaviors. And obviously, we characterize autism with deficits in social skills. So social skills are linked with the cognitive functioning that actually hinder the daily living skills of individuals with autism. Now, something that is associated with autism is tactile defensiveness. Now, tactile defensiveness actually it comes under an umbrella of terms which is governed by something known as sensory defensiveness syndrome. And so what is tactile defensiveness? It is a hypersensitivity or responsivity to touch situations that most persons find non-threatening. Now, what does this mean? Like our daily grooming activities, maybe toothbrushing, even taking a bath, maybe simply changing the positions of our seating, standing, anything. In fact, even touching, say, certain colors. These are very normal activities for us, but in the autistic mind, it actually triggers something, it triggers a very hyper response, and which this hinders their normal daily cognitive functioning as well. So toothbrushing is actually, for us, it is very easy. We wake up and we brush our teeth, we are done with it. But in reality, it is an activity that has a lot of what I can say, the involvement of the brain is lot at many levels, be it motor skills, be it social skills. So toothbrushing involves multiple muscles of the upper limb with cognitive ability. And I was talking about the tactile defensiveness. So something like dental care, as I said, toothbrushing is actually a level 2 or a moderate severity of self-care skill that children with autism can suffer from. And this is why it can eventually lead to their poor oral health status. And as I said, motor skill deficits are very common and mainly associated with upper limbs. So it is one of the etiologies for which oral hygiene in children with autism is not adequate. And as I just said, that motor skills, social skills, and cognitive dysfunction, a triad of these three is so dangerous for carrying out our routine task easily. So, and especially tasks wherein we have to perform an activity in a sequential manner. For example, we don't quite brush our teeth randomly. We now, because it's a routine, we have developed a pattern that maybe some of us brush our front teeth, then the back, then the behind, everything. But for to get into this habit, to get into this sequence is very easy for us. But when there are impairments at a neurological level, this is actually a very difficult task. And when we talk about motor skills and social skills, I will soon go into the deeper aspects of this particular subject, where the areas of the brain that are mainly concerned with motor skills and social skills, how they hinder the normal developmental structure of any individual. So why is it that there have been so many vast attempts to help children learn proper oral hygiene? For example, we have had video modeling, we have had picture exchange communication system, there was stepwise learning, visual pedagogy is there. Now, please bear in mind, these are not failed attempts, these are all very successful attempts. The only thing is, like any other attempt, it would have its own cons. Like some of these are time consuming, some of them do not always guarantee an improvement, some of them are such that it is difficult for the caretakers to supervise. So we have to come up with an intervention which targets multiple aspects of autism at the same time. And so now we would be observing the neural components in this particular brain that is called autism. So as I said, the sensory defensiveness syndrome. Now, if we study about autism, we will come to understand that there have been many theories given to probably explain that why this particular defect even takes place. Executive dysfunction and theory of mind that you are seeing in this particular slide are actually only two of the many theories that have been given over the years. Some of them are weak central coherence, some of them are inactive mind conception. These are all at somehow they link at a neurological level only. And executive dysfunction means a lack of mind control, which actually affects the motor skills. Now you would see that there are games that children in kindergarten are taught. You know, there is a hole of a circular shape and there is a block of circular shape, and children are taught that you have to pick up this block and put it in this hole because it matches. So children with autism actually find this very difficult. That too, if we are considering an autism spectrum, the ones at the very low end of this particular spectrum, wherein the deficit is very severe, they will find it very difficult to associate two circular patterns. And so this is how their motor skills will be affected at a gross level. Now, when we are considering the theory of mind, it indicates that there is lack of intentionality, which means their social skills would be affected. Now, what does this mean? For example, a child just wants to go through a corridor, but there are two people who are standing exactly in his way. So a typically developing child would probably, just pat the individual standing in the way, tell them to move aside, and then he would go forward. Or he would say, excuse me, I have to go ahead, and so on. But a child with autism would simply push through the two persons standing there. He probably won't even make an eye contact with them. And so this is the theory of mind. It indicates a lack of intentionality. It's not in the child's mind to actually be rude or something, but it's just how this particular brain works. And the anterolateral system is one such neurological pathway which signals the onset of pain, crude touch, tickle, and in children with autism, it has been found that another pathway, that is the dorsal column medial lemniscus, through the sensations of vibration, pressure, and tactile sense, it inhibits the anterolateral system. So, the signals that are meant to be positive for us, that somehow would tell us the actions that we should or we should not do, these won't be acquired by the child with autism. He won't understand this particular social domain. And this is how a major aspect of sensory defensiveness syndrome comes into picture. Another thing is about impaired motor function. Now, as you can see, there are 4 boxes in this particular site right at the top: early online control, pre-program phase, limb target control, and homing phase. Now, you might wonder what this is, but actually it is just a culmination of the events that take place when I have to pick up a pen. That's it. So this is our neurological network. Early online control means I am seeing the pen and I am just programming in my mind that how I have to pick up this pen. Pre-program phase involves very sub-optimized movements wherein I decide that which fingers will come into play when I have to pick up this particular pen or any other object. Limb target control is the actual action that goes into picture, and homing phase involves the correction of any error that has taken place. Let's say I pick up a pen but I am a bit clumsy. I know that the hold is not proper, so I will correct my grip, and this is known as the homing phase. So this is how a normal neurological network works when I simply have to pick up an object. And because I am picking up this object, I know that this particular thing in my hand has some use. With this particular pen I am going to write. So the mesolimbic cortex comes into picture, and it will tell me about the reward that I am going to get. That is, that with this pen I can write. Then comes the frontostriatal circuit, which actually governs the motor, cognitive, and behavioral functioning. So this is like picking up the pen is my motor activity. Behavioral functioning is the use that I do with it. But in children with autism, what happens is, or in individuals with autism, what happens is that the cerebellum, that is the center of motor skill governance, whatever motor skills we are doing, it is all because of the cerebellum, and that will have an impaired mesolimbic cortex, that will have an impaired frontostriatal circuit, there will be an increased frontal cortex. That means increased volume of frontal cortex is usually associated with impaired motor control. There will be alteration of the white matter. Now, as we know, we have 2 particular matters, the gray matter, the white matter. The gray matter is actually responsible for all the nervous impulses that are present in our brain, and the white matter is meant for transmitting those impulses. So when the white matter's volume is altered, it means that there will be some learning impairment. That means this gives us an idea that every motor skill is somehow linked with a social domain as well. And there are certain cells in the brain known as the Purkinje cells. Now, Purkinje cells have a very patchy distribution in the minds of children with autism. And these are the cells that are actually responsible for transmitting all the nerve impulses from one area of the brain to the other. Sorry. Now we come to abnormal social skills, the thing that actually defines autism in most cases. And the basal ganglia and the amygdala, these are the 2 regions of the brain that are mainly associated with impaired social skills. Amygdala, as we know, is the center for emotion. The basal ganglia is actually associated with goal-directed movements, communication, language, all the social traits that you can possibly think of. And the 2 images you can see on the left are of those areas of the brain, the red circles, the fusiform gyrus, the inferior frontal, the inferior parietal lobule, the superior temporal sulcus. These are the areas in the brain that are associated with social cognition. And a very particular part of our neuron system is the mirror neuron system, and this is what helps us in imitating things in our language areas, in associating a feeling with whatever we see. Uh, then we have a decreased gray matter. Now, the impairment in mirror neuron system actually makes it difficult for an individual to imitate things, and also they find it very difficult to associate between left and right. And since these areas directly overlap with the ones that are concerned with communication, like the Broca's area and the Wernicke's area, children with autism or individuals with autism often have difficulties in speech as well. And there were two theories that actually tried to explain the mechanism of the impaired neural networking of autism, that is the optimal control theory and the connectivity hypothesis. It is just a summary of what I explained till now, that the basal ganglia, it gives a sensory feedback from a motor control, whereas the cerebellum, that is our that gives a proprioceptive feedback from a motor command. Also, what the connectivity hypothesis states is that the cortical connections in the brain are actually the short range ones are more and the long range ones are less, which actually straight away is linked with social deficits. So this is a summary of the brain morphology that we see in individuals with ASD. The size of the corpus callosum, the structure of the brain that connects the two hemispheres, is reduced. We have a poorly organized cerebral cortex. There are abnormal action potentials in thalamus and basal ganglia because of the patchy Purkinje cell distribution. Gray and white matter is altered, cerebellal function is altered, and the amygdala is altered. And so now we come to music. Music is a multimodal stimulus that can activate the visual, somatosensory, auditory, and motor components of the brain. So this seems probably about right, an intervention that can trigger or activate the multiple areas of the brain that we have seen till now. In fact, as you can see in this particular image, playing, singing, moving to the beat of music, these all motor functions actually activate the cerebellar region. Music evoked emotions and experiencing pleasure. They activate the gyri, and the sulci we saw were associated with social deficits. One form of music therapy is interactive or self-instrument playing, and a systematic review has proved that it helps in achieving a significant improvement in areas that are associated with cognitive, communication, behavioral, musical, and motor skills in autistic individuals. So this is a wonderful flowchart that was given by Bharati et al. In 2019. So longer instrument playing, the motor activity through instrument playing, these actually are, they have found out that they increase the cortical area of the corpus callosum. There is improved speech and communication, because what increases the action the areas in the brain where the action potentials are increased are the ones that where we can see an overlap of the areas that are responsible for the motor and social skills. Then we have the rhythm, which improves because of the cerebellar function. Rhythm training can activate the basal ganglia and the cerebellum. The various pitches that the brain actually pursues while even listening to music improves cortical plasticity. And these are the various forms of music therapy, like auditory motor mapping technique, melodic intonation therapy, rhythm therapy, which is the focus of my study, improvisational music therapy, and other sound therapies. And all of this somewhere are associated with the fact that they help in targeting skills like communication, social communication, the emotion, evoking the emotion in individuals with autism. And the elements of music therapy can be listening, singing, music making, making rhythmic movements, and all this can help in simultaneously enhancing the communication, social, emotional, motor, sensory, perceptual, and behavioral factors in individuals with autism. So The instrument that I chose for my particular study was the tabla, which is a percussion instrument. It is a leather-based instrument. As you can see in this diagram, we have 3 rings on each drum. The left one acts as a bass, the right one is the treble, and it is the sound production is that takes place in this instrument is completely by the brute force of our hands, of our fingers. Um, by playing the tabla, since we are playing it with our fingers, we are directly improving the fine motor skills of the player. It engages the mirror neuron system because there are beats that are played on both left and right drums. It has been previously proven effective in improving motor skills in children with Down syndrome, and because there is a direct involvement of the hand with the brain, because the calming effect of the vibrations of this particular instrument delivers a deep pressure technique. So in this, whatever the sound is produced, it has a calming effect directly on the brain. Now the thing that you are seeing over here is the electronic metronome. Metronome is nothing but a instrument that helps in delivering a constant pitch, a constant rhythm, in which the students or the players are supposed to play in that particular speed limit. So the only sound that would be coming from the metronome is this is all. It will go in a particular pattern, and this actually directly affects the cerebellum, where the motor functioning is associated in typically developing individuals. And so the aim and objective of my study was to evaluate the changes in oral health status of children with autism by training them in playing the tabla, and also I wanted to see if there can be any changes in the motor skills and social skills. The flowchart on the right actually sums up my particular research work, wherein there is an association between music, neurology of autism, oral health, motor skills, and social skills. So the children that I picked for my study were between the ages of 4 to 12 years. Obviously, I was guided by a pediatric neurologist and a psychologist who helped me in uh, uh, carrying out the diagnosis of ASD in the picked individuals through the childhood autism rating scale. Exclusion criteria was if a child had impaired vision, hearing, or had congenital absence of limbs. Um, I went to 2 particular schools of special kids, and they helped me in knowing if any of the participants were involved in any prior training sessions for music, drawing, creative drama, etc. And they should not have received any music intervention within 6 months of my study. The Institutional Ethics Committee of the College of Dental Sciences and Research Center helped me in getting the ethical clearance. And a beta power method was employed to calculate what would be the ideal sample size for my study, and it came out to be 22. Luckily, I had 24 subjects whom I could randomize into 2 groups, a control group and an experimental group. The control group received only oral hygiene instructions, and they did not receive any music therapy intervention compared to the experimental group. And the experimental group was like they received the music therapy sessions for 3 months. Now, before the intervention and after the intervention, the scales that I employed were the gingival index and plaque index. Uh, Both these scales were carried out by my colleagues who helped me in assessing the severity of gingivitis or the intensity of the plaque that was accumulated on the teeth surface of the participants. Then there was autism social skills profile, which helped in evaluating the social skills. And in this, I had to personally interview the parents or the caretakers of the participants and children were rated on three particular measures, that was social participation, social reciprocity, and detrimental social behavior. And finally we had the quality of upper extremity skills test for evaluating the motor skills, and this particular test was carried out by a occupational therapist. The quest this particular scale was actually initially employed for the individuals who had cerebral palsy, but later in 2012 it was found that this is also applicable for autism. Michael Thorpe gave a model of music therapy for children with autism back in 1984, and I followed that particular method where the pattern of my teaching resembled Michael Thorpe's model, where I had to divide my chapters actually into three particular groups: basic level, intermediate level, and the complex levels. At the basic level, I had to guide the children's fingers to the desired area of the instrument from which sound could be produced. At an intermediate level, I had to ask them to play the beats on both the drums simultaneously, and slowly and slowly, as you can see on the table on the left, the same muscles that are involved in toothbrushing were gradually being activated by various beats that were played on the tabla on the left and the right drum. And eventually, after 3 months, when the scales were once again employed for the assessment, we found out that motor skills had a significant improvement in both the groups. And when it came to oral health, there was a significant reduction in plaque index at an intra-group level. At an intergroup level, there was definitely a reduction in the GI and PI scores in the experimental group. However, this was not as significant. When it comes to social skills, the social participation aspect showed a significant improvement in the intergroup comparisons. The intragroup comparisons showed that the social participation along with reciprocation had a significant improvement. However, when it came to the detrimental social behavior of children, there was a very little difference. Definitely, there was a decrease in their detrimental social behavior, but not as significant. So, based on my study, I came to realize that irrespective of the age of the participants, music is a wonderful intervention that can be actually that should be actually used for a longer period of time in children with autism. And why I focus on the children part is because the sooner we employ an intervention on these particular individuals, the better it would be for them in the longer run. And Whipple reported in 2004 that sorry, irrespective of the age of the participants, type of intervention, treatment, methodology, profession, and music provider, the intervention can be carried out. Lucky for me, I am trained in tabla. I am a graduate in tabla and in Indian classical music. So I knew how to carry out this particular uh, study. And in order to enhance the motor and social skills of children with autism, music therapy in various formats can be employed. Playing drums has frequently been associated with improving the social skills of children with autism. In fact, a systematic review has also shown that social outcomes like communication, participation, has shown improvement not only in children but also in adults. And it takes around 8 to 12 weeks in which we can see a change in the brain connectivity of children with autism when they are intervened with music therapy, and this was proven by Sharda et al. In 2018. So the four takeaway points: poor upper limb coordination is a major factor for detrimental oral health in children with autism. Oral health status did follow improving the music therapy intervention. The motor and social skills showed an enhancement after the music therapy sessions. An interplay between these variables affects the oral health of children with autism. and a correlation can be appreciated between the similarities in the muscles that are used during the act of toothbrushing and playing the tabla. These are my references. Thank you. I would conclude by saying this particular excerpt that from article in the Journal of Clinical Child Psychology. We must keep in mind that a lack of empirical data does not infer that the treatment is ineffective, but rather that efficacy has not been objectively demonstrated. So what this means is, if you come up with an idea, please execute it irrespective of thinking whether this would be effective or not. If you can carry out, if you have the resources in hand, please go for it, because at a longer run all this contributes to enhancing the lifestyle of individuals with autism. Thank you.